This is Health Talk, your weekly dose of analysis of current health issues. We broadcast live from Johannesburg in South Africa. I'm your host, Dr. Selom Daoud. A very good day to you. Now, in today's show, we discuss urinary incontinence. And to pose a question to our expert panel or share your experience on the subject, please call us on Johannesburg 714-6843, 6847, or 6857. But before we discuss our main topic, let's take a look at a current health story making headlines. The Ebola epidemic continues to dominate headlines. As demands grow for more international help to fight this deadly virus, Cuba's former president Fidel Castro has said his country will send almost 300 extra doctors and nurses to Africa. Take a look at this insert by our senior producer, Jody Setti.
The World Health Organization says the current outbreak of the deadly Ebola virus in West Africa is one of the most challenging it has ever faced.
It has, again, been a busy week, and there's going to be a lot of issues that we need to address today. So some of the priority issues are going to be thinking about staffing for Senegal.
We look forward to deploying more staff next week.
Chief Science Officer.
Started to tackle the issue of potential mutation of the virus.
It was a call to mobilize support even beyond medicinal intervention. And yet again, Africa is under siege. The CDC are tracking the spread of the deadly virus.
Our response is running short on nearly everything from PPE, body bags, to mobile laboratories, to isolation wards. But the thing we need most of all is people, healthcare workers.
This is the worst Ebola epidemic, and efforts to contain the disease are failing, but still the world dilly-dallies. And then it hit Europe and the United States, and then there was swift action. They deployed troops to help curb the spread. Cuba, by all means the poorest in comparison to the big economies of the US and the UK, has deployed 250 troops of medical workers to Sierra Leone, Guinea, and Liberia. This has solicited a muted response from the United States.
We will cooperate with a brigade of 165 collaborators, consisting of 62 doctors and 103 nurses. All of them have more than 15 years of professional experience and have worked in other countries facing natural and epidemiological disasters.
Cuba played a decisive role in the defeat of apartheid in South Africa. This was recognized by Nelson Mandela when he visited the island from prison.
Before we say anything,
Antes de hablar absolutamente de cualquier tema,
you must tell me when you are coming to South
me
Africa.
tiene que decir cuándo viene para Sudáfrica.
Conviértase Sudáfrica en modelo de un mundo futuro más justo y más humano.
Let South Africa be a model of a more just and more humane future.
The history of Africa would have never been what it is now. One of the greatest friends that Cuba has is Nelson Mandela and his appreciation for what the Cuban people did and Fidel Castro.
The island has pledged to send more health professionals to combat Ebola. Experts warn that the rate of infections could reach 10,000 a week by early December. 10 months into the Ebola epidemic, the death toll keeps rising. Health workers say many people are dying than what is recorded by the official figures. Cuban doctors, like many other health workers on the ground, are putting their own lives in harm's way to save others. As USA for Africa says in their song, "We are the world, we are the children."
All right, so in our lineup today then we discuss different types of urinary incontinence, its causes, clinical features, long-term complications, its impact on quality of life, and of course its management. Remember to pose a question to our expert panel or simply just share your experience on the subject. You can call us on Johannesburg 714-6843, 6847 or 6857. Please don't go anywhere. This is Health Talk on SABC News. Now, urinary incontinence is said to be a common and embarrassing condition to many. But what exactly is urinary incontinence and how does it occur? Take a look at this insert produced by Tamim Bogan.
The human body has two kidneys that continuously filter the blood to make urine that is emptied into the bladder. The bladder itself has muscles that control its emptying and filling function. As the bladder fills with urine, its muscles relax, allowing it to stretch to accommodate the urine. A valve at the bottom of the bladder is kept tight to prevent any leaking of urine. When urinating, the person voluntarily relaxes the valve muscles while contracting the bladder wall muscles to get the bladder to void the urine. Urinary incontinence is the involuntary loss of urine. It is not a disease, but a symptom of some underlying problem. Symptoms can range from mild leaking to uncontrollable wetting. A person is said to have urinary incontinence once such control of bladder function is lost. Worried about what to do in an emergency situation, urinary incontinence can be treated. It is advisable to consult your doctor.
Okay, to enlighten us on this problem of incontinence, we're joined by a special guest in our Johannesburg studio, Dr. Margaret Fokuma. Dr. Margaret Fokuma is an incontinence specialist and is also president of an organization called CASA, Continence Association of South Africa. Dr. Fokuma, welcome to Health Talk.
Thank you very much. Nice to be here.
All right. We had a brief, insight into what incontinence is. Would you perhaps like to take us through what it is and the different types of this incontinence?
Okay, the important thing about incontinence is if you leak, you have incontinence. It doesn't matter if it's a tiny little bit or a huge amount. If there's any leakage of urine or of stools, you have incontinence. Mm-hmm. And we should do something about it.
All right. So it doesn't matter what it is. If you didn't plan to pass urine, and it just happens accidentally, that's incontinence.
Absolutely, yes.
All right. Do we know of different types, perhaps? We hear there's stress. I don't know how stress causes incontinence, but perhaps you enlighten us a bit on that.
Okay, if we look at different types, stress incontinence, people always say stress, but I'm not stressed, it's not anxiety.
Yeah.
It's got actually nothing to do with stress as such. Stress incontinence means that when the bladder is full, if you increase the pressure on the bladder with coughing, sneezing, jumping, running, when you have your sphincters that close off the bladder and they're not strong enough to stay closed, when we increase that pressure on the bladder, you leak a little bit of urine, and that's what we call stress incontinence.
Okay, so it's got nothing to do with mental or emotional stress or anything like that?
No, nothing like that. Then our next type of incontinence is urge incontinence. Now, urge incontinence is caused by what we call an overactive bladder. So during the filling phase, our bladder fills. It's like a balloon that we're blowing up. Once the bladder's full, we normally get a message from the brain, our bladder contracts, the sphincters release, and we have a normal void. But when we have an overactive bladder, during that filling phase, the bladder contracts. And that contraction is then interpreted by the brain as urgency. And if the contraction is strong enough, and once again the muscles aren't strong enough to keep the bladder closed, we leak urine. And that's called urge incontinence, caused by an overactive bladder.
Okay. So in a sense, you're saying that the message starts somewhere in the brain and gets relayed to the bladder. Perhaps, do you want to just take us through the normal process of urination? How does one urinate normally? How does it start?
Okay, so normally our bladder fills. There's sensors on the inside of the bladder, and they're sending messages the whole time to the brain, telling us how full our bladder is. So if we sit down here and think, how full is my bladder, you can get a sense. So that's happening the whole time that the bladder is actually filling. And we're making 1 to 2 milliliters of urine per minute. So the bladder is constantly filled. It's like a tap that's open. So as it fills, we get the messages. And as it's slightly fuller, the urgency gets a little bit stronger. And then we feel, okay, now we need to go to the toilet. Then the brain sends a message to the bladder, switches the bladder on, the bladder contracts, and the sphincter is released, and we have a normal void.
Okay. All right. So we've heard of stress incontinence, urge incontinence. Now we hear there can be a mixed type?
That's right. So you can have urge and stress incontinence combined. And one will dominate the other. So you will be leaking when you're coughing, running, but you'll also just suddenly leak and you don't know why. And that's when you've got both combined. We often see that a patient will present with urge incontinence, but when you examine them, you find they have a stress component as well.
Okay. And what is this overflow incontinence?
If we once again think of the bladder filling, if there's an obstruction to the outflow, so we see this with patients, for instance, with an enlarged prostate, so it's more common in men than in women. The bladder stretches and stretches, and now you go to the toilet. Instead of the bladder contracting nicely, we get a weaker contraction, and urine stays behind in the bladder. So if we had, say, 400 mils in the bladder and you void 200 mils, then 200 stays behind. So your bladder's filling all the time. And eventually the pressure builds up in the bladder because it becomes too full. So it's a dam that overflows. So then you start leaking urine because your bladder has become overfull.
Has it got anything to do with volume? For instance, I mean, are there differences to the extent to which people can, accommodate X number of liters in the bladder?
Yes, absolutely. Females' maximum capacity is usually around 400 milliliters. Men between 500 and 600 mils. Obviously, if your bladder is very stretched, you could hold a little bit more. But we often find that patients with overflow incontinence will be holding up to a liter of urine in their bladders. So their bladders become very overstretched.
All right. Now let's come to the problem then of incontinence. How common is it?
It's very common. It's a lot more common than we realize. We don't have specific statistics because people are rather shy to admit that they have a problem. So they often have incontinence, don't see anybody, don't ask for help. But it's estimated that there are about 200 million people worldwide suffering from incontinence. So it's
Do you have any idea how many people in South Africa?
We're not 100% sure, but we think that from the health surveys that have been done that the amount of patients are very similar to the other statistics worldwide. If we look at young people, it's maybe 5 to 10%. By the age of 50, we're probably getting sometimes between 25 and 50% of patients suffering from incontinence.
Yeah, yeah.
And
All right. Of course, when you say young people, we're not talking bedwetting and young children, which is a totally different subject. But let's talk about who it affects most. It is said that it affects more women than men. How far true is that?
In the younger age group, 50 and below, more women than men. But as the men's prostate glands enlarge, we find that the overactive bladder component in the male population increases, and we actually find more men over the age of 60 suffering from urge incontinence than women. So then it starts to level out a little bit from that side.
Yeah. And are there any differences in ethnicity, perhaps?
We find that people with weaker muscles tend to have more incontinence, especially your stress incontinence component.
Yeah.
So people with strong muscles, less so, but it depends on what's happening. We find that it depends on, in the female population, what happened during childbirth.
Yeah.
So if there's been in a first world situation where they're in hospital and the birthing process goes quite well, not so many, but in areas where there's not a lot of medical help, we often find really bad incontinence in our female patients.
And I guess the difficulty is that because it's not something that's easily reported on, we don't quite have accurate statistics.
No, we don't, unfortunately.
Okay, all right. When we return, we'll take a look now at causes of incontinence, and we look at what impact this condition can have on quality of life. And for any questions you may have, by the way, the number to call is Johannesburg 714-6843, 6847, and 6857. Please stay with us.
Zoom into Africa. This is the Kingdom of Swaziland. The leader is His Majesty King Mswati III. Swaziland got independent from Britain on 6 September in 1968. The population is more than 1 million people. One of the major languages spoken is English. Monetary unit is Lilangeni.
This is Health Talk on SABC News. Now, urinary incontinence is a condition most women don't want to talk about. It has the potential to negatively affect quality of life in multiple ways. It may affect any of our physical, mental, emotional, social, and even occupational aspects of our lives. Take a look at this insert produced by Tando Ngumal.
Urinary incontinence happens when a person cannot control the emptying of his or her urinary bladder. Incontinence is not a symptom of old age. It affects all people from all walks of life, but it is common to older people. Women are more likely than men to have incontinence. Children are no exception to this. This includes bedwetting. People struggling with incontinence normally suffer from depression as their quality of life is affected. Dawn has incontinence and she is managing it well with the help of two doctors, Dr. Stephen Cornish and Dr. Lizelle Grindal.
Dawn has overactive bladder condition where she has to go to the toilet many times a day. And she feels a marked pressure inside the bladder that she has to go. She can't hold on. It occurs more in the middle-aged and older people, but it can occur in younger people too. The problem with this condition is that it's quite difficult to treat. There is medicine that can be used to treat the condition, but it often doesn't make a huge difference, and there are often side effects with the medication.
She has had challenges, but with time she is getting there.
Ek kan nou uitnodigings aanvaar.
I can now accept invitations. I don't have to ask where the restrooms are. I can do my shopping. I can drive with ease, and in peak hour traffic, I don't have a problem. Before, I used to get very nervous, and it was very embarrassing. Now I feel better, and I'm enjoying my life.
Unfortunately, most people who have incontinence don't seek medical help because either they feel embarrassed to talk about it or not realizing that there are successful, easy to implement treatment options. Most people with this condition tend to isolate themselves from socializing, and it affects production at work to many. It also affects people's personal relationships with their partners. But if you have this condition, it is not the end of your life. With the right diagnosis, there is a range of treatments available out there. Consult your doctor.
All right, we'll continue our discussion with our incontinence specialist, Dr. Margaret Forkiman. If you thought that bedwetting belongs to young children, you're obviously wrong.
You're right.
Let's talk about the clinical features now. I mean, we know that incontinence means wetting oneself, for lack of a better way of putting it. Are there any different grades, perhaps?
Yes, no, you can. You can actually grade the stress incontinence grade 1, 2, or 3, and the amount of leaking is directly related to the grade. So a grade 3 stress incontinence patient will leak all the time.
Right.
Their sphincter muscles are completely gone.
Right.
A grade 1 stress incontinence patient will leak with activities. And a grade 2 stress incontinence will leak more easily with certain activities.
So it's more likely then that the ones with grade 1, perhaps the mild ones, would tend to ignore that and don't report it quite often.
Yes, they don't. They often just carry on and think it's normal, part of aging, or I've had a baby, so I should expect this.
Right. But then what about people who tend to, they're not wet, but they tend to, go to the toilet often at night? Could you regard them as being incontinent?
Well, they've probably got an overactive bladder component, and if they don't treat it, they will probably become incontinent as time goes on. So it often starts just with the frequency and the sense of urgency, getting up at night, and eventually ends with a certain degree of incontinence.
Well, all things being equal, I mean, if you take away effects of alcohol and medication, is there like a norm to say if you're seeing that you're going to the toilet more than X number of times a night, get worried? Is there any such?
Well, if you go to the toilet more than 8 times in 24 hours, it's too many. As long as you're drinking normal quantities of fluids.
Right.
So if you're eating and drinking normally, more than 8 times in 24 hours is considered abnormal.
And you're talking adults, of course.
Adults, yes. But even in children.
Yeah. All right. Now, is there any problem associated with, wetting yourself all the time? Any possible complications that can arise there?
Well, first of all, infections.
Yeah.
Patients often develop bladder infections, which obviously could then become complicated with kidney problems as well. And then the skin rashes, the actual being wet all the time, they start to develop a skin rash which can become infected. They can develop sores in the perineal area, which is very uncomfortable. And your older patients that aren't that mobile, if they have to run back and forth to the toilet, they often fall. And there's a very high incidence of patients being admitted for fractures due to incontinence because they're running to the toilet. So those are the more serious things that can happen to you.
Yeah. Perhaps this leads us to the next, thing that we spoke about earlier, the impact that this problem has on people's quality of life. Do you perhaps have stories of, because you see, it's not something that people readily talk about, but you as a continence specialist, you probably get a lot of these people coming to you with these problems.
They do.
Yeah.
If you ask a patient with incontinence, what is the worst thing that can happen to you? And they said, embarrassment. The absolute fear of wetting themselves in public in an area where they have no control over it. And I can think of a few instances of patients that have told me stories that have happened to them. We sort of think of it as the old little frail lady in the old age home. But I had a patient, he was a CEO of quite a big company.
Okay.
He was
I'll tell you what, maybe sorry to interrupt you. We apparently have a caller on the line, and the caller is anonymous. Hello, welcome to Health Talk.
I hope you do understand I'm the reason of being anonymous.
Yeah,
I've had this problem since I was young as 9 years at school. I used to publicly wee myself. That got better with time. I often go to the clinic and they only tell me that it's a urine infection. They deal with it. After some time it goes back. And what I've realized is that the more I use public toilets, is more I feel as if I'm more frequent to visit the toilet, but when I'm at home, I'm more comfortable. But be driving on the traffic, I'll be more pressed than I could ever. And this has also affected me in terms of sexually. During an intercourse, I would feel like I have to stop and just run to the loo. So that has been my problem for years now.
All right. Any question you'd like to ask her before she goes?
When she goes and sees the doctor, do they actually test the urine for an infection, or is it just a diagnosis that's made on history?
Oh, no. Just because I'm a young lady, they just check if I'm not pregnant. That's the assumption, that I could possibly be pregnant as much as I go to the loo frequently.
All right. Okay, Anonymous, thank you very much for your question. We'll attempt to answer it as we go along, yeah?
It sounds as if she's describing overactive bladder with urgent incontinence problem.
Right.
Going to the toilet frequently, and they often have symptoms that are very like a urinary tract infection. So they have that urgency, even burning of urine during urination. And
but could it be long term? Because she says that since the age of 9,
yes,
she used to wet herself quite a lot.
We often find that this goes. There's definitely a hereditary component. It goes right back to childhood. They often have a history of bedwetting as well, and this very long history that's just getting progressively worse.
Yeah. Let's look at risk factors. I mean, talking about, genetic factors. So clearly there are genetic factors as a risk.
Yes, no,
okay.
we definitely see that.
All right. What about pregnancy?
Pregnancy in itself is a risk factor for developing incontinence.
Yeah.
If you develop incontinence during your pregnancy, it's a pretty good predictor that you're going to have problems with incontinence later in life.
All right. Just hold it there because we appear to have another call on the line.
Yes.
Gift, welcome to Health Talk.
Hello, how are you?
Good, how are you?
Well, thanks. I'm so glad I caught your show today.
Right.
I'm having a problem with my mom. It started when she gave birth to her last born.
Right.
And she's also asthmatic. It's gotten so worse that every time she coughs, especially when she's having a dry cough at night, that she just leaks. We even have to buy what you call this pads for her. Is there a facility around Joburg where I can take her? Because apparently she's even stopped dating since my father passed away due to this issue.
All right. Okay, we'll give her that information a bit later. And thank you very much for your question. Dr. Fokima?
Yeah, it sounds as if she should go and see her doctor and have a proper examination. And the important thing here is to diagnose what kind of incontinence she has.
Yeah.
Because then you can treat it.
Since the mother gave birth to, the last
so
sibling.
we need to make sure, is it stress incontinence? Was there any birth injury that's maybe contributing to the incontinence? So she needs a good examination to make sure exactly what the problem is.
All right. Then let's carry on our discussion on pregnancy. What actually happens during childbirth that, results in incontinence afterwards?
Okay, just to start with, during the pregnancy, you're carrying this huge big baby, which is pressing down onto the pelvic floor.
Right.
So that's already causing a problem. Then during the whole pregnancy, our ligaments and our muscles soften and stretch to accommodate the birthing process.
Yeah.
So just the pregnancy itself, just carrying that weight around, and that's where obesity also is a problem. So if you're carrying extra weight, you increase your risk factor for developing incontinence.
Right.
And then depending on the kind of birth, if you have a cesarean section, you obviously are going to be sparing those muscles, so there's a lot less of a risk of developing incontinence. But if you have a natural birth and it's not controlled properly and there's tears and things like that, then you are at a much greater risk of developing.
Do you have any idea of how common incontinence is in people that give birth naturally?
It's much higher. I don't have the exact numbers, but it's definitely much higher than if you would have a cesarean section. Yes.
Okay. Not that we're promoting cesarean sections. All right. But anyway, let's talk about obesity and obviously BMI, and then the waist-hip ratio. what is the difference and why is it a risk factor for incontinence?
Well, if we think of the pelvic floor, it's a whole lot of muscles that's like a basket holding all the pelvic organs nicely in place.
Yeah.
So if we are overweight, we're increasing the pressure on our pelvic floor, on all of those organs, and we tend to think that they have this very strong sort of muscle holding everything up.
All right, let's just hold it there, talk about holding it. We have Khotso on the line. Hello, Khotso, welcome to Health Talk.
Hi, doctor. I just want to find out about at night. You want to go to the bathroom, but it's very difficult to wake up. So obviously you have a lot of urine inside of you, and you end up waking up in the morning only to release yourself. And I just want to know, would that cause that urinary incontinence in the future?
Interesting question. So the idea of training yourself to hold that urine in the bladder for longer periods, is that a risk factor for incontinence later on?
If you hold on too long, but during the night, we have a hormone that's produced to concentrate our urine. So we make a quarter of the total urine we produce in a 24-hour period at night, and the other 3/4 during the day. So our bodies have already adapted to the fact that we shouldn't be making more than what our bladders can comfortably hold at night. So if we're not drinking excessive amounts of fluid just before we go to bed, there shouldn't be a problem that our bladders overstretch during the night.
Okay. Talk about drinking too much fluid. Are there any dietary practices, perhaps, that either puts one at risk of developing incontinence or makes incontinence a lot worse than it is?
Okay, if you have an overactive bladder, there are a whole lot of foods that are going to irritate your bladder. We always tell patients, think of your bladder as an allergic bladder. So when you drink anything with caffeine, tea, coffee, Coke, chocolate, there's a lot of caffeine in chocolate. It irritates the bladder, so the bladder contracts more. Dairy products, acidic fruits like oranges, tomatoes, the sort of cool drinks that have gas in them often are very high in sugar, so we find that aggravates an underlying overactive bladder, and you can go from an irritated bladder to full-on incontinence if you eat and drink those foodstuffs.
Okay. And what about exercise, by the way? Does it play any role in, causing incontinence or even making it worse?
I think if you exercise in a correct and healthy way, it's not going to be a problem.
Right.
If you over-exercise or you tire your muscles out, you can actually find that people will develop a kind of stress incontinence.
Okay, fascinating stuff. Okay, we're going to go for a break, and when we come back, we're now going to look at how this problem is managed. Please stay with us.
A very warm welcome to you at home. This is Afro Showbiz News, the show that brings you all things art and entertainment from around the African continent. Tunisian rapper Ben Ahmed, better known as Clay BBJ, has been released after spending 2 weeks in prison. The arrest came after he was accused of insulting security and violating public morals. The song sung by the artist criticized the current situation in Tunisia. That's Afro Showbiz. Catch us every Saturday evening at 7:30.
Healthy food is not always the cheapest food option. And so making the healthy choices, the easier choices, remain a health challenge for South African children.
Bipolar disorder is said to affect 1 in 100 people.
Low back pain, the most common spinal disorder, affects about 8 out of 10 people at some point in their lives.
Back pain persists for more than a week or two. Seek advice.
I'm Dr. Silomet Daou. Watch Health Talk every Saturday on SABC.
The Swaziland Tourism Authority invited Kaleidoscope on a media tour
of what has become known as the Little Switzerland of Africa, the Kingdom of Swaziland. The Mantanga Waterfall is one of Swaziland's best known and most accessible waterfalls, as it can be seen within 50 meters.
That's Kaleidoscope, Sundays 5:30 p.m. on SABC News.
Welcome back. This is Health Talk on SABC News. We continue our discussion on incontinence with Dr. Margaret Forkimer, an incontinence specialist, and we're now joined by another special guest, Lizelle Grindel, who is a, now you need to help me. Electropsychophysiologist.
Correct.
You know, we've had all sorts of guests on this show. It's the first time that we're blessed with a different guest of the caliber.
Thank you.
All right. She, by the way, she is from the Pelvic and Urotherapy Institute of South Africa, apparently the only one in the world or in South Africa. All right, based at Sunninghill Hospital. Welcome to Health Talk.
Thank you so much.
All right. In this segment, we're going to be talking about management. Perhaps let's, we had a chat on pregnancy, all right? Let's take it a little further now. What is it that a pregnant lady can do either before pregnancy or during pregnancy or in the early days after pregnancy to prevent development of urinary incontinence? Any of you?
You go for it. I think it's important. A lot of people think to do pelvic floor exercises while they're pregnant. And that can be conducive because you don't know if that pelvic floor is tight or is it loose. And if I can show you, the pelvic floor, as Dr. Margaret explained it very nicely, it's like a hammock. And your pelvic floor moves, so it goes tighter and looser. And the thing with pregnancy as well, the baby pushes on this pelvic floor. The more the baby grows, the more the pelvic floor stretch out. And a lot of females think posture as well is to move the pelvis forward. That's actually not so nice for the pelvic floor because it keeps it in a tension state all the time.
Yeah. Now, posture when now? During pregnancy?
During pregnancy, every day.
Right.
It's worse at pregnancy.
Right. Okay. So I mean, if you say pregnancy stretches the pelvic floor muscles, making these muscles a lot weaker, which then puts someone at risk of developing incontinence. How then can people strengthen these pelvic floor muscles?
They can strengthen it by do the correct behavioral modifications, number one. Don't go to the bathroom to go and urinate just in case because you make that pelvic floor weaker. Don't do excess exercises. Don't make sure that you're not constipated because constipation will also put pressure on this pelvic floor. They can go to normal classes, your Pilates classes and your yoga classes that is safe for pregnancy. And they will also teach them how to do it because there's various types. We call it pelvic safe exercises. We don't really call it Kegel exercises anymore.
And you're talking about classes that pregnant ladies go to during pregnancy. Now, let's talk about just after giving birth now, in those first few weeks after childbirth. Can they do anything there?
They can. Hence, nothing is wrong. They are cut. It's a little cut that they make on the perineum. We call it episiotomy. And for the nerve, it's a good idea to contract those pelvic floor muscles to actually bring the blood flow circulation more into that area, and it gives the nerves a quicker chance to regrowth, neuroplasticity to regrowth as well. They can do, but I would advise them to go to a specialist or their classes to teach them how to do it properly.
Okay.
Can I jump in there?
Sure, please.
A lot of people are told to cut off urination while they're urinating to actually feel which muscles they need to strengthen.
Right.
And we don't recommend that because during your voiding process, your bladder is contracting and your muscles are relaxing, your sphincter muscles. And if you now do an exercise where you suddenly pinch off during urination while the bladder is contracting, you can develop dyssynergy. And your nerves then get a mixed signal, so then you can actually cause a voiding problem and not be able to void properly.
This is a advice that is freely given out there.
All the
that,
time,
you know,
yes. And we see a lot of patients presenting with a problem that they're unable to initiate urination because now the muscles are staying closed when the bladder is contracting. And they should relax when the bladder contracts. So you can actually cause a dyssynergy. So we don't like that advice at all.
Well, talk about that. I mean, in men who sometimes, you know, undergo surgery for whatever reason, prostate cancer or whatever, some of the advice that they're given is exactly what you said earlier, that you need to be able to differentiate between the sphincter muscles for the bladder and your anal sphincter. So that when you do that exercise, you need to kind of know which muscle to voluntarily contract. Are you contracting the ones around the bladder, at the bottom of the bladder, or are you contracting the anal one? Is that important?
It is important, but it's very difficult to differentiate because just after surgery, those nerves are weak. You use 3 different nervous systems to void. The first nervous system, the bladder tells the brain. So imagine the bladder is like a measuring jug. As the bladder fills, we've got nerve receptors in the bladder. As the bladder fills, it sends a message to your brain. You become aware of it. You decide, is it social convenient to go and urinate or not? If it's not social convenient, it goes away. When it fills up again, it sends another message. You go to the bathroom, you sit on top of the toilet or you stand. The position is also very important. That nervous system, you can basically say, fires up 2 different nervous systems. The first, they leave the brain the same time. The first one goes to the bladder, like Margaret said before, squeezes the urine out. The second nervous system goes to the bladder neck. You don't have control over that. It's a non-voluntary nerve. Bladder neck, the pelvic floor muscles relax and the sphincter relax, you void. When it's finished, you contract and the bladder relax. This is also the only muscle that is under voluntary and non-voluntary control. So for them to just to go and urinate and have a normal urination and not to stop it and to create that dyssynergy is very important.
All right. Let's talk now about somebody who now has a problem of incontinence, and we're talking treatment, okay? Let's start with conservative, forms of treatment. What options are available for people?
Okay, firstly, if we look at behavioral, if they're overweight, it's a good idea to lose weight. If they're smoking, it's a good idea to stop smoking because of the irritating effect of the nicotine, and it also causes that chronic cough. Then we can give dietary advice, things to avoid within the diet. Fluids, a lot of people stop drinking because they're incontinent, and that actually makes it worse because that urine becomes very concentrated and they're more prone to infections. So they need to drink enough fluid, but not too much.
Just about there's this notion that you can train your bladder, drink lots of fluid, and train yourself to go to, urinate at specific intervals. Kind of keep a diary to say, okay, I'm going to drink 2-3 liters of fluids a day or whatever, and I'm going to go at these specific times. Any basis for that?
We sometimes do bladder retraining in patients who've got a total messed up urination schedule.
Yeah.
And you do actually then do a timed kind of voiding.
Yeah.
But on average, if you're drinking a normal amount of fluid, you should need to go to the toilet every 3 to 4 hours.
Right.
If you wait too long, you can overstretch your bladder. Okay. And if you go too frequently, you can actually initiate or cause an overactive bladder.
Right.
So if you're drinking normal amounts, not this whole sippy syndrome, drinking 5 liters of fluid a day.
Yeah.
We don't need that much. We probably need about 2 liters of fluid for all our sort of bodily functions, and that's food as well as fluid intake. It's not a question of you need 3 or 4 liters. You're not doing yourself any favors by drinking so much water.
Mm-hmm.
body sets its own thirst threshold as well.
Yeah.
From 1 glass of water to 5 liters of water.
Right.
So it's important to maintain the correct volume.
Okay. Now we hear that there's other forms of treatment that, for instance, Botox injections or something, injected somewhere. Do you want to perhaps just tell us where this...
Botox is very useful in the treatment of an overactive bladder.
And where do you actually inject?
You actually inject it into the bladder muscle.
Maybe let's just demonstrate with one of these models here.
Okay, so if we look at the bladder wall is made up of muscles. So you would use a scope, go into the bladder, and you would inject anything between 100 and 200 units of Botox into the actual bladder. And what that's doing is it's relaxing the bladder, preventing the bladder from contracting all the time.
Right.
It's a very useful thing to use in patients who have failed medical therapy or medication.
Right.
Because we often treat an overactive bladder with anticholinergics. So those are tablets that work on the receptors in the bladder and prevent the bladder from contracting. But they have side effects like dry mouth, dry eyes, constipation. And in some patients, they find it really, very difficult to handle those side effects.
Okay.
So it's a good use. And some patients don't react to the medication. So despite being on medication, they still have severe symptoms.
Right.
So Botox would be a good alternative.
Whilst still having that, we hear there's, things that you can do perhaps for mild incontinence, vaginal pessaries and urethral plugs. Do you want to perhaps just demonstrate how this works? Firstly, perhaps the rationale behind use of such.
Urethral plugs were used for a while, and they basically, if you see them, they look like a dummy.
Yeah.
It's a little silicone bubble that's then pushed into the urethra. In a woman, her urethra is about 2 to 3 centimeters.
Right.
And then the little bubble will stay on the inside, and that would keep the bladder closed.
Okay.
They've sort of fallen out of use. Not many people use them.
Right.
Sometimes when there's prolapse, so the bladder, a third of the bladder lies on top of the vagina.
Yeah.
So the bladder prolapses into the vagina. And because this part of the urethra then becomes a bit mobile because the tissue is then weakened, and if it's being pulled down, then they leak more easily because those muscles can't close off properly.
Yeah.
So then
perhaps for our viewers, do you want to just use this so it's clear? Yeah. Yeah.
So our muscles that close off the bladder are at the bladder neck here.
Right.
So if this part of the bladder prolapses into the vagina, it's going to pull the urethra down.
Right.
So what they sometimes use is vaginal pessaries to put into the vagina that sort of push up this wall that is prolapsed, and that then puts, it sort of normalizes the anatomy a little bit.
All right, okay, all right. Any place for medication
Sorry.
in the treatment?
Yes, we treat an overactive bladder with various anticholinergic tablets.
Yeah.
And there are a lot of new tablets on the market that work very, very well. And you can go from someone who's going to the toilet more than 10 times during the night or even during the daytime to a normal voiding program.
Last, we have a few seconds left. Neuromuscular training, what you know?
I think it's the first
maybe
and
before
foremost,
we get there, I mean,
the behavior modifications is the type of products that the patients need to use.
Yeah.
We get so many patients that come in our practice and they've got toilet paper and kitchen paper.
Yeah.
We've got proper incontinence products that's for urinary and bowel.
Yeah.
And it actually it doesn't impact the skin integrity.
Yeah.
There's male versions available.
Yeah.
And the absorption, it absorbs exactly like a kiddie's nappy, take it away from the skin. The nerves doesn't become irritable. The skin, you don't get that itchy feeling.
Yeah.
On that, if the patient do experience that itchy feeling, there is pH 4.5 balanced soaps available at the pharmacy. Anybody that's leaking, they must please use that as well.
Yeah.
So good product, look after your skin.
So where can they get these? Pharmacy?
Pharmacy, there's various types of makes. You need to go and assess what your needs are. Clicks, Pick and Pay, Dischem.
Right. Okay. All right. Okay. Well, I'm afraid that's all the time we've got. Well, thank you very much for being part of our show, these two ladies. And yes, and to our viewers, we also want to thank you for being part of our show, watching us, staying with us. So please join us again next week on SABC News. And if you've missed this live show, remember that you can catch the repeat slot at 2 p.m. and 10 p.m. Otherwise, you can also find a link to the SABC's YouTube link, which is www.youtube.com/SABC News. And from myself and the rest of the crew, we say have a fantastic weekend. See you next week.
It's impossible for a person to walk in his destiny, his full destiny, without receiving Jesus. When we are born, we embark on a journey, and that journey is to find God.
Francois de Jager's journey from a troubled little boy to the pastor of a dynamic young evangelistic crusade called Salvation 10 began at an early age.
I can remember when I was a very little boy, my father was an alcoholic and my mother had an affair with another man. I got so confused, I was left empty. Because of that split up with my parents, this emptiness just got bigger and bigger, and I became more aware of this emptiness in my heart.
Francois' misguided attempt to fill the void in his life was to start smoking. He was only 7 years old.
If I start smoking, that will sort out that emptiness and that search in my life. And then by the age of 13 or maybe going on to 14, I was addicted to alcohol. I was an alcoholic. I also got expelled from school because of alcohol and drugs. To make a very long story short, I ended up on the street because nobody ever wanted me. Nobody, because I turned out to be this washout in their eyes.
Francois ended up staying with his father, who himself was staying with some friends. Francois continued in his drinking ways, and it all ended badly one night.
I don't know how to describe it. People afterwards, after the whole event, told me I ran around and wanted to grab the children and say, I'm Lucifer, I want the children. I really wanted to be violent against my father. And the person whose home it was, he came to me and said, Francois, I don't agree with this behavior. I give you 10 minutes and then you pack your bags and you're out of my house. I turned around and I went to the kitchen and I got 2 steak knives. And I really wanted to kill this man. He phoned the police, and about 10 or 15 minutes after that, the police were there, and I went to jail.